And the next question, the member for Orléans.
Thank you very much, Mr. Speaker. My question is for the Minister of Long-Term Care. At the beginning of the pandemic, the Premier said that an iron ring would be built around long-term care homes. And despite his statements, unfortunately, thousands have become sick and died over the course of the pandemic. After months and months of dithering, the government finally announced that they would have a long-term care commission because the Premier wanted to take urgent action. Last week, the Commission highlighted the urgency of the situation in long-term care, Mr. Speaker, and advised the government to fix the chronic understaffing in the long-term care homes. Moreover, the Commission reminded the government that they know exactly how to do this already, that they've had a report since July telling them how to move forward with staffing in the sector. The government now has 2 reports telling them exactly what to do to fix the staffing crisis in long-term care. When is the government going to take action?
Again, the Minister of Long-Term Care.
I will repeat, thank you, Speaker, and thank you for the question. I will repeat what I have said numerous times before, is we have taken swift action all along, across ministries, across levels of government, working with the federal government to understand streams that we can work with them on providing the necessary training and retention for PSWs and support workers in our long-term care homes, and across the healthcare sector for that matter. This work has been ongoing, and we've been putting dollars behind it, improving the wages for our personal support workers, an increase of $3 per hour, a $461 million commitment, a $540 million put out just a few weeks ago to support the operations and in our long-term care homes, $61.4 million to make sure that our homes have the necessary supports for infection prevention and control to encourage stabilization of our homes. We continue to put out dollars behind the actions that we're taking to support our homes. We'll continue to do the work that was never done under the previous government.
And the supplementary question.
Thank you, Mr. Speaker. My supplemental is for the Minister. Well, clearly the government's own commission doesn't think that's good enough because they've asked for timely action on their advice to be taken, Mr. Speaker. This is their report, not my words. But let's also look at what's in their report. They've included sentiments from people they've heard from as part of their review so far, Mr. Speaker. Sentiments like that it's devastating and emotional, that people are lonely and depressed, that people feel muzzled and trapped, that they're broken-spirited, that the situation in long-term care was terror awakened. Terror awakened, Mr. Speaker. The government has asked experts for advice. Experts have given the government advice. When are they going to take it?
Minister of Long-Term Care.
Thank you, Speaker, and thank you to the member opposite for the question. We have been taking the advice of experts all along, whether it's our Chief Medical Officer of Health, experts surrounding virology or infection prevention and control. This has been ongoing, and we make sure that our homes have the support that they need. This is a challenging, unprecedented situation affecting long-term care homes across the world. Our most vulnerable people are in long-term care. And I want to express my deep condolences to everyone who has been impacted by this. All of us have in some way. All of us have been touched by this. And we have to continue to do the work that is absolutely necessary to shore up staffing. And I appreciate the work of the commissioners to provide this guidance. This is something that we have been working on ever since we started as a new ministry with a sense of urgency. And I appreciate the input and guidance from the commissioners. Thank you.